radiological modalities. We have talked about the basics of X ray, CT scan, and MRI. We have discussed about its principle, its use, advantage or strength, limitation or disadvantage. Okay, so I said that we will discuss today about detail about the CT with contrast and with non-contrast. Also the CT, what is CT? Angiography. Okay, this thing. So, contrast. Contrast is basically it's a chemical agent or some chemicals. These chemicals are inject before doing a scan or before taking a scan of CT scan. Patient is injected with this kind of material, this contrast agent, or patient can swallow it with water. And this, what will this agent? One second. Mr. Imon, why you are late? Mr. Imon, what, am I not audible?
No, ma'am, you are audible.
Mr. Imon, I have asked you a question. Mr. Imon, for the third time I'm asking you,
I'm
are
sorry,
you
ma'am. I
there?
didn't hear.
Okay, I asked you why you are late.
Ma'am, I was waiting in the other link the Dr. Toki that provided.
No, he already deleted the link. Uh,
No, ma'am. I tried to join that. Then I saw your link.
You are already on the
Uh,
WhatsApp
uh,
group, right?
yes, ma'am.
So please check the notification, okay?
Yes, ma'am. I'm sorry, ma'am.
Mr. Tanvir Hassan, it's already 7:20. 10 minutes has already passed.
Sorry, ma'am. Went
No
to take dinner.
dinner at that time?
Yes, ma'am. Kind
This
of
is not
busy.
this is not the way.
Sorry, ma'am.
No, simple sorry is not. From next session, I'll watch on you. Please try to join on time, okay, Mr. Tanvir?
Okay, ma'am.
And your camera is still not on. Okay, as I was saying, the contrast. So this contrast agent will go into the body and they will enhance some of the structure, enhance the visibility of the some of the structure, visibility in the scans, so that this tiny structure, this delicate structure would be more enhanced and the doctor can identify it or can find the problem with this structure easily. Okay, so if the CT scan is done with the contrast, it is called CT scan with contrast. If it is done without contrast, then it is called non contrast. Okay, in radiology both contrast and non contrast are used depending on the clinical situation. So the main difference is whether the contrast agent is administered to the patient or not. At first, we will talk about Mr. Tanvir Hassan. Your camera is still not on. I don't like people who don't follow rules. Okay, so what is it? A non contrast scan does not use a contrast agent. So, what some of the contrast agent, like they are iodine based, some isotope, iodine based dye, dye like coloring agent, or gadolinium. This iodine based dye, some it's used for CT, and for MRI gadolinium is used. So you don't have to remember the name, just know what contrast is, because when in the dictation sometimes the radiologist will utter this word, that contrast, so that you know what he is talking about. The imaging is done solely based on the properties of the body's tissue. If the body tissue needs that kind of enhancement, the technician or the technologist would use those contrast. Okay, when we are using this non contrast, use of non contrast scan, non contrast scans are often the first step in the imaging and are particularly useful in situation. So what are the situation where we use the non contrast? Number 1, bone fracture. So bone is a large structure and they are already visible on this kind of CT scan is basically a multi-directional X-ray. So bone are already enhanced and visualized. They don't need the contrast. For the bone scans, as bones are highly visible without contrast. Number two, stroke diagnosis. Okay, so this is an interesting fact. So if we in stroke, every minute counts. So administration of the contrast agent and blah blah blah, the procedure, it takes time, but we don't have that much of time because it's an emergency situation. So for that case we use non contrast agent, because in most of the time if it is hemorrhagic stroke, that means there is already bleeding and bleeding is outside the vessel. So for that we don't need that kind of contrast, okay, because it's already a large amount of internal bleeding that can easily be diagnosed. So non contrast CT is used to quickly detect the bleeding or large strokes in the brain. Got it?
Yes, ma'am.
Okay.
Yes.
And sometimes for a precise diagnosis or a better diagnosis for some stone like gallbladder stone, kidney stone, some radiologists prefer to do CT scan alongside with X-ray and ultrasound. Though ultrasound is already enough to diagnose this kind of stones, but if it is a complicated case, if it needs more detail, then some radiologist would go for the CT scan.
So,
So for detecting that kind of stones, we don't need contrast. You know why? Why we don't need contrast to detect those stones?
because those are solid.
Because
Uh,
Yes, yes,
Solid.
radio opaque, solid radio opaque and hard structure. They are basically made up of inorganic particle. That is why we don't need the contrast agent. Now the advantage. Okay. So advantage is it is faster and simpler. Obviously it is faster and simpler because we now we have the chance to skip one step, that is inserting the contrast agent. So it is faster and simpler as no contrast agent is needed. Number 2, it is useful for patient who are allergic to contrast. So if suppose I'm allergic to contrast agent, so I cannot go CT scan with contrast, but I can take the non-contrast one. So it is useful for me. And also this contrast agent, they metabolize in our body and they have some residue. They have some waste product. They create some waste product, and these waste products are toxic for us because they are drug metabolite. Drug metabolites are usually toxic for human body. They need to be excreted from our body, and the route of excretion is what? In human body, what is the route of excretion of waste product, or
the
what
kidney.
is the organ? Yes, the kidney. So basically the renal system, it is the route of excretion of this kind of toxic product. But if some patient have poor kidney function, that means their kidney is already damaged, so they cannot excrete this kind of heavy metal or heavy product, heavy toxic. So this toxin remains in our body. What will happen? They will do harm to our body. So it is also not good for the patient. The contrast is not good for the patient with poor kidney function. That is why non contrast is advantageous for the patient with kidney problem. Clear?
Clear, ma'am.
Yeah. But this non contrast agent also has some limitation also. What is its limitation? The limitation is certain structure, as I'm saying, some tiny structure like blood vessel, some delicate tumor, blood vessels, some small tumors, they may not be as clearly defined. Okay, because there is no enhancement from the contrast agent, they require this enhancement. Without contrast, they are not as visible as they would be if I use the contrast agent. Okay, clear?
Yes, ma'am.
Yes, ma'am.
Okay, now go to contrast scan. What is contrast scan? Normal. If I use the contrast agent, then it would be a contrast scan. So these agents are injected into the bloodstream, just like we take injection, or sometimes patient swallowed or insert into the body depending on the area being imaged. So it depends on the which area I'm taking the scan. Depending on that, patient doctor can inject it, or patient can swallow it, or it can be inserted into the body, okay, in any other routes. This contrast helps to highlight certain tissues and organs by making them appear differently in the scan. Differently means this organ or tissue will be more enhanced. So now what is the uses of this contrast agent? What is the use of this contrast agent? Number 1, contrast scans are used when detailed visualization of specific tissues, blood vessel or organ is required. So some example, number 1, tumor detection. Yes, Miss Famida? I'm saying the uses of contrast scan. Number 1, tumor detection. So contrast helps to distinguish between which one is normal tissue and which one is abnormal growth, because tumor are nothing but a abnormal growth, isn't it? So
Yes, ma'am.
this contrast agent helps to distinguish between which one is our normal tissue and which one is abnormal. That means it can detect the tumor. Then blood vessel imaging.
Ma'am, will it detect also non benign tumors?
Benign and malignant, it is detected by CT,
Contrast with
MRI.
contrast.
No, MRI. Only MRI can distinguish between the cancerous and non-cancerous, not the CT. CT can only identify the tumor, detect its location, its size, its extent, and its spread, not its nature. Okay. So for the blood vessel, we need the contrast. So it enhances the blood vessel to detect the blockages or abnormalities. But here is a but. If my main concern is blood vessel, like if there is a coronary artery disease, so my main concern is the blood vessel. Okay, I don't know, I don't need other structure, I don't need to see the other structure, but I need to see only the condition of artery of a particular vessel. In that case, I would go for CT angiography. If I'm taking a general scan and where I'm also looking for the vessel, so my vessel is not my prime concern, but I just wanted to see its condition. In that case, CT with contrast. But if my prime concern is only the vessel, then I would do the CT what?
Angiography.
Angiography. Clear? Clear on that?
Yes, ma'am.
Yes, ma'am.
And also infection or inflammation. So this contrast highlights the areas of infection by showing the increased blood flow. So one of the sign of inflammation, in inflammation the blood flow is increased at the site. site of inflammation. So this
Yes,
increased
ma'am.
blood flow will be detected by the CT
Contrasting
scan,
agent.
contrasting agent, a CT with contrast. That's how we can identify infection or inflammation. Okay. Now the advantage of CT with contrast. So they provide better differentiation between different types of tissue, especially the soft tissue. CT with contrast provide better differentiation between different types of tissue, especially soft tissues. Number 2, more detailed imaging of the blood vessel, tumor and other structure. More detailed imaging of blood
আম্মু
vessels,
দরজা আটকাইছো?
tumors and other
এই পাশে
structures.
দরজা আটকে দাও।
Now the limitation of CT with contrast. It requires the use of contrast agent which can cause allergic reaction. So in CT with contrast agent is needed, and it can cause allergic reaction to some people, and it can also, it is also contraindicated for the patient with kidney issues. And also it is time consuming and little bit complex rather than the non contrast, because it's need time to take the scan and do the preparation, as contrast must be administered. Mr. Abdullah,
Yes, ma'am.
okay, tell me something about non contrast scan that you have understood by this discussion.
Okay.
But
Non-contrast.
you're not, I cannot see you. Why every time I have to ask you to open your camera?
My webcam is not working last 2 days. I have talked to Redon Bhai last
Okay,
exam time.
okay. But try to fix it as early as possible.
Yes, ma'am. I'll
Okay,
work to fix it.
go on.
Okay. Non-contrast CT scan is basically a, a lot of X-ray radiation or image taking. It's like a lot of X-ray image taking from like it's from every 2 inch of our body, and
Mr.
it has so
Khalid,
many.
um,
Yes,
I didn't talk about 2 inches or something in today's class. So
in
I'm
today's class.
asking
Yes,
about the you have your notes, right?
yes, yes.
So tell me
Okay,
from your notes.
okay. So the advantage of non-contrast CT scan is
Why the
uh,
advantage? At first, start from what is non-contrast. Then go what in which condition we use non-contrast. Then the advantage, then the disadvantage. Everything has its sequence. Go sequentially.
first of all, I should start from the what is non-contrast, right?
Yes.
Okay. The non-contrast CT scan is I already told, taking X-ray radiational image, a lot of X-ray radiational image of our specific body, where we take for CT scan.
Mr. Khalid, tell me the truth. Did you take notes or not?
Yes, yes. I
But
took the.
these are not the lines from your notes, and I
I
haven't.
actually messed up with the city contrast and non-contrast
Why
of
I
the
have go?
definition.
I have.
Definition, but
It's why you need the definition. It's already in the name. Non-contrast. That means in that case, no contrast is used. Mr.
yeah.
Khalid, don't give me excuses. I know you didn't take the notes.
May I go for next like function? It is used for bone fractures, stroke diagnosis. Stroke diagnosis because it's quickly detect a bleeding of the vessels, and I can say next things actually. May I?
Miss, next thing what?
It's like advantages, limitations,
Okay, so
and
I I only talk about only two uses of non-contrast?
I didn't get it actually.
Mr. Rasha, yeah, Miss Rasha, how many points I have told everyone about the uses of non-contrast?
Ma'am, 3 points.
3 points. Okay. Mr. Imon, what is the last point?
Ma'am, inflammation detection.
No, no, non-contrast.
Gallbladder stones and uh,
Yes, very
gall.
good. Okay. So how can this trainee can answer and you cannot?
I missed the corridor.
No, you didn't miss. You turned off your cameras. That means you think that I will just join here and I will not listen to anything. And it's not necessary for me to take notes. Am I just blabbering some kind of funny words? Everything has its reason. I can simply make a PDF or slide for this topic, and this topic is not even in your SOP, but I personally made this topic and I'm teaching you so that your concept would be little bit more clearer. And I'm emphasizing on taking hand notes because whenever you take hand notes, you don't have to study it. I don't have to study because whenever you take notes, you got everything. That doesn't mean I'm wasting my time and also yours. Okay, let be. Miss Jannatul,
Yes, ma'am.
could you tell me about the uses of contrast CT scan?
Tumor detection, blood vessel, and inflammation detection.
Very good. Then what would be the limitation of contrast?
Ma'am, allergic reaction, some kidney issue, or tissue, ma'am, something tissue. I cannot note, take note those.
If you cannot take note, you should have asked me.
Okay, ma'am. Next time I'll ask.
Okay, what is the point?
Three tissue
So the limitation number one, that allergic
allergic
reaction.
reaction.
It
Then
is it is not indicated or it is harmful for the patient with kidney problem. The number three, it takes time to take the scan and it is a complex procedure. Okay.
okay, ma'am.
Okay. Now another important topic, that is difference between CT angiography and CT scan with and normal CT scan. Difference between CT angiography and normal CT scan.
Ma'am,
Yes.
can you speak little slowly?
Okay. Okay, as we know, a regular CT scan is used to take detailed images of our body's structure, such as it can take the images of bones, organs, and tissues, and it can be performed with or without contrast, and that depends on what the radiologist is looking for. Okay. So, what does it show? In non contrast CT, it is great for identifying fracture, large internal bleeding, then some stones. And CT scan with contrast, it is excellent for identifying tumors, infection, blood vessels. So, as a whole, general body imaging for diagnosing, we use normal CT scan with or without contrast, because CT angiography is a special one. We use normal CT scan, that could be with or without scan, for general body imaging for diagnosing condition like trauma, cancer, pneumonia, or kidney stone, or any stone in the body. And it can focus on any part of the body. CT angiography focuses only on the blood vessel, but normal CT scan, it can focus on any part of our body like our head, chest, abdomen, pelvis, etc. So normal CT scan, it can focus on any part of our body, but CT angiography focuses only on the blood vessel.
Ma'am, CT angiography also conducted for coronary arteries, right?
Yes. So coronary artery disease, it is the disease of the vessel. In that case, CT angiography would be the best. Okay, now we will talk about the CT angiography. So what is CT angiography? CT angiography, it is a specialized type of CT scan. So CT angiography, it is a specialized type of CT scan that also uses contrast agent. CT angiography also uses contrast agent, but it is a specialized type of a CT scan. Clear? And
Yes, ma'am.
it specifically highlight the blood vessel. Specifically highlight the blood vessel. And assess the blood flow. It creates detailed images of arteries and veins. CT angiography create a detailed images of artery and veins to identify the blockages, aneurysm, or any abnormality in our vascular system.
Ma'am, to identify.
To identify blockage, aneurysm, or abnormalities in the vascular system. So what does it show, the CT angiography? CT angiography is primarily used to examine the blood vessel. You know, we already know it is primarily used to examine the blood vessel, and it can show the narrowing of the blood vessel. What do we call the narrowing of the blood vessel?
Stenosis.
Very good, stenosis. Okay, then blockages, aneurysm, and abnormal blood vessel growth. So basically all the problem with the blood vessel. And it provides very detailed images of the blood flow through the arteries and veins, so that it makes easier to assess the vascular condition.
So, ma'am, basically for the heart block, it's to CT angiography.
Yes. Now the uses. Number 1, heart and coronary arteries. In the heart and coronary arteries, to check for blockages that could lead to heart attacks. Then in the brain vessel, okay, to check for in the brain vessel, to same thing, vessel abnormality, that could be blockage, that could be aneurysm. Then in the lung, pulmonary embolism. Mr. Prattoy, what is pulmonary embolism? Okay, pulmonary embolism occurs in which organ?
Heart,
Pulmonary embolism. Which organ?
lung.
Lungs. Okay. So, to detect the, remember pulmonary embolism? It's basically a blood clot that causes obstruction in the pulmonary artery. That is called pulmonary embolism. So, to detect the blood clots in the lung in pulmonary embolism. Number 4, peripheral vascular disease. Peripheral vascular disease. One of the peripheral vascular disease is DVT, deep vein thrombosis. Peripheral means the vessel is in our periphery. What is the periphery? So it's like away from the center. If we take the head and our chest the center, then the legs would be the periphery. Our hands would be the periphery. To evaluate blood flow in the limbs.
Ma'am, peripheral vascular,
Peripheral
peripheral vascular
disease.
disease.
Okay, now if we make a difference between CT and CT angiography, so at first the focus. Normal CT scan, Mr. Abu Talha, normal CT scan focuses on which structure?
Basically, it focuses on the our organs, normal organs. Like, okay, I have to go through this. Our blood vessels, tubers.
No, not only the, not, don't say
Uh,
the blood vessel at first.
oh, sorry, blood vessels are for the contrast, right?
Yes, yes.
Our kidneys to detect kidneys problem.
So in normal sense, the answer would be regular CT scan image or can image any structure in the body. They can image any structure in the body. And Mr. Protoy,
Yes, ma'am.
CT angiography focuses on which structure?
Blood vessels.
Blood vessel.
Okay, very good, blood vessel. Now the contrast requirement. Mr. Famida,
Yes, ma'am.
do normal CT scan require contrast agent always?
No, ma'am. Sometimes it needs non-contrast also for the bone fracture, kidney
Yeah.
issues.
So it is basically depends on the clinical need.
Clinical need, yes.
Okay. Miss Rasha,
Yes, ma'am.
can we do CT angiography without contrast?
No, ma'am. Because we need to focus on blood vessels, and the blood vessels are so tiny structure. That's why we need to use contrast here.
Very good. So we cover two difference. One is focus, another is contrast requirement. Now the third one, purpose.
Ma'am, why a CT scan with contrast is not enough for blood vessels blockage?
Okay. So it is depends on the way of contrast agent is administered. Okay, we will talk about it. Just now finish the difference. We also have this topic. Okay, now the purpose, Mr. Rubaid. What is the
Yes,
purpose of
ma'am.
normal CT scan and
CT
CT
is
angiography?
normal CT scan uses for bone tissues, and CT angiogram is used for vascular system like blockage and aneurysm.
Aneurysm. Very good. Now, Mr. Salman, what kind of detail I would get from CT, normal CT scan and a CT angiography?
Uh, so normal CT scans is mostly used on solid structures in our
Solid?
bodies. So uh, I mean,
No, no, I'm asking about the amount of detail.
okay. So CT angiography is used for blood vessels details we need to uh, diagnose or see. Normal CT scans cannot do it. Normal CT scans mainly focuses on the areas, mostly our whole body, but it provides detailed images of our bodies that is conducted the examination on the part of our bodies. But CT angiography is a special type of uh, CT scan that provides uh, detailed images of our blood vessels uh, to to understand aneurysm or blood blockage.
Okay, so you got your answer. So if my prime concern is my blood vessel, why would I go for a general one? I should go for the specific one that would give me more specific result. If my prime concern is blood vessel,
Yes, my question was the CT scan with contrast mainly. It's
okay, so
angiography is
CT
different.
scan with contrast can also show the blood vessel, but CT angiography mainly shows the blood vessel. So which one I should go for? That provide me the extra, some kind of extra benefit, or that only focuses on that particular structure. So all the details is all about the blood vessel, or in the CT scan with contrast, I can see the blood vessel, and in the city with angiography I can only see the blood vessel. So which one is
Mhm.
more detailed?
Angiography.
That is why, okay, so it's like at first, so if the blood vessel disease is not confirmed yet, if the vessel problem is not confirmed yet, it is just a suspicion or suspected case. In that case we can do, or doctor is not sure about the diagnosis, in that case he can do a whole, as a whole CT scan, a
CT
general
scan with
CT scan, that
contrast.
is CT scan with contrast. But if, but now he sees the contrast agent shows there is a, maybe
There's a
there is a
problem.
problem with the blood vessel. So now the all the focus is on the blood vessel. That's why doctor is now will do a CT angiography, because he found that there might be some problem with the blood vessel. Now I will go for the detail, I'll go look into it more deeply. Okay.
Okay. Well, ma'am, CT scan with contrast, there is allergic reaction to some
Hmm.
patients, right?
Yes.
So, uh,
Hmm.
in angiography, will it will be allergic uh,
Yes,
for
yes,
those
that
people?
would be also be allergic for that patient. For that case, other modalities may be used, or if so, there are um, there's some numbers of contrast agent. If I have specifically allergy with iodine, then I can go for other contrast agent, other one, a different one. So there is always an alternative to everything. Clear?
Ma'am, does CT angiography and CT contrast use same chemical agent, contrast agent?
Maybe. Okay, so yeah, the contrast agent is same, but the procedure is not same. That is why they are different. So in CT with contrast, so what is the main difference in the procedure between the CT angiography and CT with contrast? So what so at first the contrast agent is injected into the blood. So in CT scan with angiography the timing is very specific. whenever something is injected into your blood, that things will be in your blood for some times and ultimately will be go into the tissues and they will excrete from your body but in situ angiography our main or our prime focus is the blood vessel, not the tissue. That is why after administration quickly we have to take the scan, so we have to maintain the timing, we cannot delay, because we if we do the delay then the contrast agent would be go from the blood vessel to the tissues, then our purpose will not be served. What was our purpose? To enhance the blood vessel, we wanted to see the blood vessel, but the contrast agent is not in the blood vessel, they are already gone. So my blood vessel will be visualized. Hmm?
No, no.
We need to keep the contrast agent within the vessel, but the time is limited. So we have to take the scan within this limited time. But this is not the case in CT with contrast, normal CT with contrast. In normal CT with contrast, the timing is not specific. So the contrast agent is injected and it can go to the tissues, it can remain in the vessel. It's not our concern because we are taking the scan as a whole. So contrast agent can spread throughout the tissue, throughout the blood. That is not the problem. But in case of CT angiography, contrast agent must be present within the vessel. Okay, that is why we need to maintain the time during CT angiography but not in the CT with contrast. That is the main difference in the procedure.
And this was the answer I was looking for.
Okay, so let's I have sent a difference in your WhatsApp group. Maybe you can ask for the old previous trainees, they will provide you guys the difference with CT with contrast and CT angiography. Okay,
Okay.
so CT with contrast they focuses on organ tissues and blood flow, but CT angiography only focuses on blood vessel and blood flow, mainly the blood vessel, mainly the blood vessel. CT angiography focuses mainly on the blood vessel, but CT with contrast they focuses on organ tissues and maybe blood vessel and blood flow. So as a whole, it is as a whole. Purpose is for general diagnosis, like for the tumor, inflammation, internal bleeding, but CT angiography it is vessel specific. That means the problem should be specific to blood vessels like blockage, aneurysm. Timing of the scan in CT with contrast, no specific timing as I have already discussed, but CT angiography precise timing is needed to highlight the vessel. Use of contrast dye, yes, they both use the contrast agent. I guess all are clear now with this topic.
Yes, ma'am.
So I will give you a assignment, that is do assignment on everything we have discussed regarding this topic, these basics of radiology. So this assignment should cover everything today's class and our last class. Okay, this assignment for everyone, you guys, and also from the for the guy in team A also. I'll also notify them. So what Tokir Bhai has discussed today with you guys?
Ma'am, day 10.
Only
Important.
the anatomy?
Yes,
Ligament.
Ligament.
Only anatomies.
Okay, we will talk about the disease, and maybe within 30 minutes we will end the session. Then you will have your dinner break or everything. Then from 9:30 we will start our assessment. Okay? Yes, Miss Rasha.
Ma'am, I have seen that the diseases from day 4 and day 5 has not
There
been covered fully.
has not covered fully because
Hmm.
though uh, Toki Bhai has said that he has already completed the material, but do you guys need another session?
Yes, ma'am, based on the diseases, because some diseases are not covered.
Covered, okay, but I didn't know that, and we don't have. So you want to cover this in today's class, or we will arrange another class for that?
Ma'am, I think it will be better if that covers on today's class.
Today's class, okay. And I'm providing you the link. Everyone join on that link. We will discuss about the disease in a short. Okay.
Okay, ma'am.